Dr. Guillermo Arroyave.
Guillermo Arroyave Borges was born in Guatemala on June 29, 1922. He obtained a degree in chemical science and pharmacy from San Carlos University of Guatemala, master's in nutrition science by the Institute of Technology in Cambridge, Massachusetts, and PhD in biochemistry from Rochester Medical School of New York. In 1949, he starred as the first recently graduated professional hired by the newly founded Institute of Nutrition of Central America and Panama, INCAP, with headquarters in Guatemala, where he established the first biochemical nutritional laboratory. He was a pioneer in using micromethods for the assessment of the nutritional status in population groups, and with this contribution, he made possible, among others, the evaluation of the program on iodization of salt, the biological effectivity of INCAP, which is a food complement, and a reliable characterization of nutritional status of population of Central America and Panama during the 60s. The epidemiological assessments carried out by INCAP during nutritional surveys of Central America and Panama from 1965 to 1967 confirmed that hypovitaminosis A was a large problem in the population. On those grounds, INCAP decided as a high-priority initiative to investigate the strategy to increase the uptake of vitamin A in order to help the population reach an appropriate nutritional level of that nutrient. In 1969, a research program was started by Guillermo Arroyave to fortify with vitamin A an available foodstuff accessible to the people. With that purpose in mind, table sugar was identified as the most appropriate vehicle. He led laboratory and experimental studies that peaked with the making of a stable premixture. He also carried out clinical studies to determine vitamin A absorption, field surveys to establish the levels of sugar intake, and he actively worked with the sugar industry in the development of semi-automatic prototypes for the dosing of the fortifier. The bill on sugar fortification with vitamin A, approved by the Guatemalan Congress, mandated the compulsory fortification and the establishment of the National Program on Fortification of Sugar with Vitamin A. The program started in November 1975, and it was simultaneously assessed at a national level through monitoring, quality control, and nutritional impact assessment. Field operations were held during 2 years with 5 surveys with diet, clinical, and biochemical studies, including studies on maternal milk sampling and liver biopsies. The country evaluation proved a significant reduction in vitamin A deficiency in the Guatemalan population. The results were published in the scientific publication number 384 of the Pan American Health Organization in 1979, and it states, "In conclusion, we can say that the program on vitamin A fortification of sugar has definitely contributed to allow the Guatemalan population to satisfy its individual and social right to consume the necessary amount of vitamin A to maintain an appropriate nutritional status in regards to this nutrient." Guillermo Arroyave worked at INCAP from 1953 to 1982, where he provided fruitful contributions in scientific, education, and social fields. As an investigator, he was brilliant and a visionary, always optimistic. His publication add to more than 200 scientific articles, book chapters, field and laboratory manuals in the field of nutrition and diet. On August 17, 2008, he died at the age of 86 in San Diego, California. Guillermo Arroyave Borges was an outstanding scientist. With his vision and ingenuity, he gave Guatemala and the world a real solution to prevent and control hypovitaminosis A, with its terrible consequence of partial or permanent blindness, especially among children.